Welcome to another episode of Health Matters with PA Lynn Szabo. I'm Heather Polen. What are we going to talk about today, Lynn?
We're going to talk about why we vaccinate.
Ooh.
I think it's time for just a little reminder with some specific examples.
Okay.
And so one of the problems with vaccination is that it's so successful at lowering disease rates that providers and patients lose track of why these preventable diseases are so bad in the first place.
You mean lose track, like as we forget, like that
Right.
polio crippled children and
Right.
took their lives and put them in our lungs, and
Uh-huh.
we no longer have a living memory of
Right.
having watched that pain and suffering.
Yeah, my 40-year career, I've never seen it, although I've seen post-polio.
Yeah, I've known a lot of older people who had polio and were
Right.
struggling with it as grandparents.
I think it would be hard for me, for example, to diagnose measles because I've never seen it clinically.
Okay.
You need to see at least one case and get it locked in your head.
So I'm pretty sure if you saw measles, you wouldn't forget it after that, right?
Oh, no.
Okay.
These illnesses are not just some minor colds. They are significant illnesses. And like I just said, for polio, they have long-term sequela. That means consequences of being sick. And at the time people are sick, they cause significant suffering and life disruption. So I wanted to visit a couple of them. So pertussis, hepatitis B, human papillomavirus, and measles, to give you a memory of what they're like. So pertussis is also called whooping cough, and it's caused by Bordetella pertussis. I think that's kind of interesting because that reminds me of kennel cough.
I was going to say, isn't that kennel cough?
Right.
Is it the same thing?
I think it's a related organism, not quite the same thing.
Okay, that would make sense.
And it starts off just like a mild cold with a runny nose and, maybe a little bit of cough. But it has a prolonged infectious stage. And by the time you figure out that you're dealing with pertussis, a lot of people have been exposed and it's super contagious. So it moves through a prolonged and severe coughing stage kind of toward the end. So it's known as the 100-day cough.
So more than 3 months.
Yeah. And it's not just a little, I mean, it makes my coughing look like not so big a deal. It's terrible. Infants especially can't breathe because they're coughing so hard. And babies are known to die from it.
Don't they cough enough that they break their ribs and things?
Yeah, and I have seen that. Yeah, absolutely. And adults, actually.
Yeah.
Well-nourished adult males.
Coughing hard enough to
ribs.
break their ribs.
So I want to remind people out there that in 2010, Del Norte had an outbreak of whooping cough. It was diagnosed at the urgent care level at the old Sutter Coast Urgent Care. And within, about a half hour of it getting out that that baby had whooping cough, we had about 10 doctors over there trying to get immunizations because we had a little glitch with the immunizations countywide. I think it was because it was a weekend and we had the only 10 immunizations in the county. And so providers, on hearing that it was a thing in the community, were showing up demanding to be immunized.
Wow.
Yeah.
Now, when you say there was an outbreak in 2010, and I remember going
Yeah.
to get a vaccine through that, but I don't remember the number of people who actually were diagnosed with whooping cough here in the community.
I don't remember either, but I think it was more of a fear because people clamped down and immediately went to vaccination. So I do remember that at the middle school, so Crescent Elk Middle School, they were immunizing kids at the school.
Oh, okay.
And I cannot imagine that happening now. I'm sure they had to have a permission slip and parental consent for it, but nobody argued like this is a bad thing. This is going to cause, immunizations are bad. It was like, I want mine and I want it now.
Yeah.
So, which is not a good strategy to face epidemic diseases in a community, because after you're immunized, especially a kid in the middle school age, they probably had their last pertussis immunization 5 years before, and it's going to take probably a period of time, I would say some response to the shot within 2 weeks and probably optimal response to the shot within about 6 weeks.
Okay.
So
Is that a guess, or is that the data's on that's there to support?
I think both.
Okay.
Yeah. In general, that's how it works out. I don't know about specific data for pertussis, but in general, that's what we're told to tell people. And it's the community did what needed to be done, protected the vulnerable people, and I don't remember it being much in the way of actual illness because there was a quick response.
Yeah.
Like within a half an hour, there were providers in the community trying to update their own so they could take care of people.
Yeah.
And it didn't go anywhere in Humboldt County either, I think, for similar reasons.
Yeah. So at one point in time, our community had the bandwidth and the capability of saying, oh, our children are in danger. Let's do something about that.
Right.
Okay.
And they picked middle school kids because they were the most, not the most vulnerable, but the most likely
to spread it because they don't wash their hands. And
both to parents and to really, really vulnerable infants.
Yeah.
So I was proud of the community then.
Right.
Yeah.
So was I. It was amazing to
It was a good thing. And I don't think anybody really remembers anymore. So do we really have to learn that lesson over again? So
apparently,
yeah. But think about it. If you're contagious for probably about 3 weeks, probably 2 weeks before and 1 week after, and if you're coughing for at least 100 days, and this particular disease is transmitted by droplets, right? So people coughing,
all up in the airborne, and you're breathing it in,
right? It just makes sense to keep your immunizations as up to date as you can. And for a standardly immunized adult person, that's one of the shots every 10 years. For a kid, an infant, it's immunizations at 2, 4, 6 months, and then I think they do it maybe a year, and then 4 or 5 years before they go into school.
And if I'm not mistaken, the pertussis is also, so like if I stepped on a nail or something, they're going to give me a tetanus shot. That's combined together, correct?
Those are combined. So
that's every 10 years you're just going to go get that unless there's a reason that you...
So that shot complex has protection against diphtheria, which I've never seen, pertussis, which I've lived through, and tetanus, which I have never seen.
You lived through like as a provider, or you lived through as a patient?
Both.
Oh, man, I'm sorry.
Yeah.
We'll have to, one of these days, we'll have to cover your experiences having
my
whooping cough.
Look through my chart anyway.
I'm glad you survived.
So that was an example of something that could have gone really wrong, that the community here, specifically here, stepped up, did the right thing, followed instructions from the people who are in the know on what to do, and shut it down.
Yeah.
Protected our children.
Yeah.
So I was super impressed with Del Norte about that. Now the next disease has been in the in the news a lot, and a lot of really wrong things are being said about it. So the next one is hepatitis B. So hepatitis B immunization is super cool because it technically was the first immunization that was able to prevent cancer.
Wow. And just to be clear, because it hears in my headphones, it hears weird. You're saying hepatitis B as in boy.
Boy.
Okay.
Yeah. There's a lot of viral hepatitis. The word hepatitis just means inflammation of the liver. When you has the letter A, B, or C, and then you start getting into Greek letters like delta, those are viral causes of
the inflammation. Okay.
Yeah.
Okay.
So this,
thank you.
In particular, I think the original reason that it was created was that they didn't want people to have to suffer from the disease because hepatitis B is a potentially fatal disease, and one way that it kills people is it actually causes liver cancer. It's probably the most common form of liver cancer.
Okay. I didn't know that was a cancer that was caused by the virus.
Yeah.
Okay.
So super cool. And, for immunization geeks, we were walking around for about 10 years going, yeah, that's the first, it was kind of like a Trivial Pursuit question to show how in the know you were about medicine. But people who have the chronic form of hepatitis B, live with long-term liver inflammation, failure, and like we just said, a possibility moving on to cancer. It is treatable, but the process is difficult and requires skills that are not usually available here.
Okay.
Probably.
So we don't have somebody's. Is there like a special name for the doctor that treats your liver?
Well, the hepatologists, those
Okay.
are the liver doctors, kind of want the family practice people to do it, but the family practice people feel like it's too complicated and they really want the hepatologists to do it. And we don't have anybody that I'm aware of. Maybe Dr. Castle in Klamath treats it, but the closest person I know for sure would be Dr. Hovorka in Humboldt Open Door Clinic System, who is retiring this year.
Oh, okay. So yeah,
So-
we're not going to have access again.
Yeah, I think there's outreach clinics that go as far north as Eureka.
Okay. Thank you.
Okay. So it's not a great disease. Transmission is via sexual activity and needle use, but certain populations have it as transmitted during birth. So what I hear in the news is, why would you immunize a kid for something that's essentially their risk is an STD? Why would you immunize them at birth? Because it's possible to get it at birth. It's called vertical transmission, and it demonstrates specifically why it's important to immunize newborns for this particular
Okay.
infection.
Would that also be why it's important for pregnant women to be tested for STDs, even if they are in a committed relationship, that
And
they believe they're in a monogamous relationship, just to be ensure that they don't pass those things to
Right.
their child?
Yeah, we screen
Okay.
everybody no matter what their
Which is-
perceived situation is.
Right. Better safe than sorry.
But it's not impossible, especially up here, probably in the swamp, maybe, or with the resurgence of, at-home, certain types of at-home births, for a pregnant woman to not have had prenatal care. And it's possible to have the disease without knowing it. And it's also possible for labs to be falsely negative, when what that means is the result is wrong.
Yeah.
Because of the timetable you're looking at, because of a tube switch at the lab, and that's why the shot's recommended at birth. Because when neonates or newborns get it via vertical transmission, they have a much rougher time, and the possibility of them living to adulthood is much reduced. So easy, safe, cheap shot to get it as a newborn with fundamentally important protection. And I think I want to insert a little story in the life of Lynn here. Is that when I was in PA school, I got a needle stick off an HIV positive person. And he didn't know he had HIV because 40 years ago they didn't necessarily tell him.
Well, it was a pain in the butt to get tested for it as well.
Yeah, exactly. And so there were no protocols at that time to say, okay, this is how we respond to this situation. So I had to get HBIG, which is immunoglobulin, which is a human blood product.
Wow.
So if this kid's growing up unimmunized for Hep B and they get a potential exposure, they have to get a human blood product.
When we could have just simply given them a vaccine that's
Right.
safe at
Right.
birth.
And human blood products are fairly safe, but they're not as safe as the immunization. So if you're looking at relative risk, just get the kid immunized.
Yeah. So, and is this, so if you get the Hep B vaccine at birth, do you have to get boosters later on? Is this something you follow up as an
Right,
adult, or is
right.
this something like every 10 years?
Right. They
Like-
get usually offer a boosters at 2, 4, 6 months old, and then also as they're going into school.
Okay.
So I was a non-responder later on when I had myself routinely tested. I was a non-responder to the vaccine when it first came out. So I've actually had 9 hepatitis B shots.
Oh, wow. So
Yeah.
by a non-responder, you mean like if they drew your blood, you didn't have the immunization?
They didn't have any evidence that the immunization, air quotes, worked on me, but it actually did. But the proof didn't show up until I was exposed to chronic Hep B as a pregnant woman, and Yeah, and so they had to draw me to see that I had protection, and then it finally showed up.
Oh, okay. Well, that's good.
Yeah. So, but the shot has been refined. Remember, that fetus is now 32 years old. So we're talking about a long time ago.
Okay.
And she was born safely. She didn't have it. She was immunized in the newborn nursery. She was part of the first wave at Mad River of kids that got that immunization. And in our family, that was a safety issue, and it wasn't questioned.
Okay.
So she's okay. I'm okay. So the next one is also something where I've seen actual pathology here in Del Norte County, and I'm talking about the human papillomavirus. So until immunization, this virus was the most common killer of women worldwide. Not really in the United States, but worldwide.
Yeah. Right.
Right.
We didn't.
Human papillomavirus is probably the 100% cause of cervical cancer.
All right.
And so women worldwide, number one cause of death. But in my experience in Del Norte was completely different. I've seen 4 cases in my time here, which has been about 25 years, that of HPV-related cancer. One was in a woman, and she's okay. She got the care she needed. But 3 were in young men who chewed tobacco, who were in their early 30s.
Wait, they got HPV from chewing tobacco?
They got HPV probably from oral sex.
Oh, I'm sorry. Duh.
Yeah. But
Was it exacerbated by the tobacco?
yes.
Sorry, that was a big word to say.
Pouring gasoline on a fire.
Oh, okay. See, I see
Yeah.
what you're saying.
And so they had lesions, and all 3 of them had lesions in their mouth. One was under his tongue, one was, I think, around his lower jaw, and one was around the upper jaw. All 3 had extensive surgeries. All 3 had disfiguring results. All 3 had a effect on the way they talked. So you're missing your tongue. You probably can't talk so that people understand it very well.
Or taste food.
So these 3 men, normally patients' parents don't really see young men as having a need for this because they don't have a cervix. Well, number one, you're raising a child to be a full functioning human adult. And that usually, is sexual activity is
They're going to have oral sex too.
Right. And they're
Okay.
going to have oral sex, and we can talk about oral sex without vaporizing. And I know. And if they're chewing, this just gets worse and worse. So I would say to protect these young men, they were probably not in the age group where they were immunizing
So men
at the time, but they were close.
Are we immunizing boys for HPV too? Or is this just
we,
something we do
we
for
offer
girls?
it, and it's advertised, but I don't think people see it as a young man's problem.
So immunize your sons too.
Yeah, immunize your sons. And if we look at it on the lowest level, the women are getting it from somebody, right?
They're getting it from men. So
Right.
if I'm not a medical, I'm not a provider. I don't have
Right.
your training.
Right.
So but a curiosity, if we vaccinate our boys from HPV, will that prevent them from spreading that to us? From men from spreading it to us
Do you mean
during
as
sex?
their female sexual partners?
Yeah.
Yeah. Yeah, it shuts that down.
Well, why the hell are we not
Why
vaccinating
is this not a thing?
males, whatever phrasing here you want to
Probably
use?
because the initial studies in the development of this vaccine, the goal was to reduce cervical cancer, and they didn't really understand the role of HPV and other types of head and neck cancers. They think it actually might be a related cofactor in some types of lymphoma. And so where are these lesions picked up? Well, the guy who had the lesion under his tongue was standing around with coworkers, and he threw his head back and had a hearty laugh at a joke at somebody. And then his tongue went up to the roof of his mouth, and his mouth was open while he was laughing. And his coworker spotted the lesion. He had no idea it was there.
My gosh.
And it was huge. It was about an inch across.
Holy bejeebies.
Yeah. So
Okay.
and with the lack of dentists, it's, a dentist would see
Yeah.
signs of it in somebody's mouth. Young people don't go to dentists for multiple years in a row.
Yeah.
So something could develop.
Jeez.
So And part of what triggered this conversation right now is I was involved in a discussion yesterday about this particular immunization, and the fear was expressed that it was killing people. Okay. And
The
that this
HPV vaccine was
killing
killing
people.
I have never heard that.
No.
Of all of the stupid things around vaccines, I have never heard that
It's
about
totally
this one.
not true. So we went into the data, and we saw the number of people who had died. I think it was something around 44, and then 27 of those people had absolutely no evidence the vaccine was related in the deaths, and the remainder were kind of nebulous.
What do you mean by nebulous?
That it wasn't clear what killed them.
Okay.
So they couldn't say for sure that it wasn't the HPV shot, but it certainly
and
could
that's
have been.
just in the United States, a certain state, or are we talking globally?
No, we're talking United States, and it could be. It could be that somebody has an anaphylactic reaction. You could go out to eat and have an anaphylactic reaction. So
Yeah.
so I don't think it's inherent in the shot. I think it's the inherent is, it's the dice you roll. But so many more people died of cervical cancer, head and neck lymphomas, head and neck cancers, and the morbidity of not being able to speak or to have your looks, destroyed because you have part of your jaw removed. I think it's so much higher. I mean, I'm sorry for anybody related to the person who was hurt by the immunization, but there's so many more people saved.
Right?
Yeah.
But that would be like if you said, so breast cancer runs in my family, right? And that if there was a vaccine for breast cancer, I'd be first in line to go and take it so I don't have to worry about it.
Right.
And if I ended up dying for it, I would still say, get the damn breast cancer vaccine. If you have a history of it in your family and you can prevent it, go do it. Even if I was the person who died from it.
But so that brings me to a concern I always hear when I hear somebody saying, oh, but the side effects. Why are you so lucky that you're going to be one of those, whatever 44 minus 27 is.
Good Lord.
It's like, do you feel that lucky when you buy a lotto ticket?
Yeah, and they still buy that.
Yeah.
And like statistically, right, when we talk about those things, you're more likely to die driving to work.
Right.
And you still freaking drive to work every day.
Our
You're
whole
taking a
day
greater
is-
risk there and you don't have to think about it.
Our whole day is we go through risky activities and we don't even think about it because for the most part, nothing happens.
Yeah. Wow.
I want to talk about measles really quickly. It is not at all a benign childhood disease.
No.
There's an outbreak right now in Washington, like north of us, Washington State. And we've talked before about how this disease can ravage children. So encephalopathies, which means infections in the brain, blindness, problems created with folk remedies, and most commonly death. So risk levels of untreated disease are way higher than any minimal risks of the immunization. It is clear that it does not contribute to autism. That has been debunked and debunked and debunked. And now we're in the midst of a national epidemic due to under-immunization. So I would counsel you, if you decide to get your medical information from a podcast, well, that's ironic to have said that.
From a podcast from somebody who is not medically trained.
Right. If you decide to go it alone in a data-free zone, then you have to have a backup plan for what happens when the disease shows up in your community and by extension your family. And be prepared to have a very sick child that could require hospitalization, could require being flown out to the city. It could be, and at a minimum, will be quarantined for weeks. So how many people can afford missing work for months to care for a sick child? That could be catastrophic to a family.
Yeah.
Whereas you can get these immunizations that are safe, pretty much free for everybody, and easily available.
Right. And then there's the parent guilt, right? If you watch your child suffer from something horribly, horribly suffer day after day after day because you were a ninny and believed some dude that's getting hundreds of millions of dollars a year to tell you some lie about a vaccine when you could have just done it. The guilt and the shame from that is unreal. And you go find those parents and you talk to them about it and they will tell you. It scars the parents mentally and spiritually that they fell for something that somebody profited off of and their child suffered because they did not just go look at actual data.
Right. And doing your research, air quotes again, is not scrolling through Instagram or Facebook or TikTok.
No, that's confirmation bias.
Yep. So most adults in this country who are now parenting were immunized themselves and have had nothing but benefit. We rarely see it.
Oh, that's true, isn't it?
So what was it?
I got mine, you got yours, but we're going to deny our little ones and let them suffer from it.
Why would we deny our children, something that's been demonstrably safe through the whole world, not just the United States?
It's good enough for you and it's good enough for me, and we don't have to worry about getting those illnesses and suffering, but we're just going to make piss poor decisions for our babies.
Right. And I think sometimes that mothers especially don't want the child to cry. They don't like the idea of somebody, quote unquote, hurting their child. The people who give shots in the community clinic level are really good at it. And a baby will cry for seconds and then oftentimes get put to the breast and be fine.
Okay.
Whereas, if you wait until you get them just before you go into school, those kids are kicking people and fighting and terrified and screaming. The entire clinic can hear what's going on.
Yeah.
And that's...
I got nothing for that part. That part always sucks. I've gone with nieces and nephews to do their vaccines and friends' babies and things. And I sit there and cry with them too. That's sad.
Right. So why would you wait until they're just about ready to go into school and then pile on a whole bunch of vaccines?
That's true.
And give them a big traumatizing visit so they hate the doctor. I mean, they look at us with major stink eye and they never talk to us again. So, you got immunized. You probably don't even remember it. I certainly don't remember being immunized. I've gotten immunized because of my career, and I don't remember even it was a big deal. My children were told it was a safety issue, and it was the parents' job to make sure the kids were safe. They never whimpered.
Yeah.
Yeah.
I do remember getting some of my childhood vaccines, but some of mine were delayed due to illnesses and autoimmune diseases that I have. But again, my mom made sure that I got them when it was deemed safe for me to do so. And I think I was just like a year behind, if I remember correctly. Right. But yeah, that was it.
And your parents probably immunized your siblings on
schedule.
On schedule, and then part of the reason they did that was to protect you.
Yeah, and again, like I've said this before, I'm one of 8, and 2 of us had to have slightly delayed.
Yeah,
and that was it. It was slightly delayed, and she made sure the rest of us had it.
When my younger daughter got her first immunization, I held out for the injectable polio vaccine because I thought it was better. And we had to go get it in a special place. Her older sister cried, but not the baby.
Right.
It was cute.
Yeah.
That's how it rolls for them.
Yeah, I did. As a big sister, I'd cry with my younger siblings to go.
Yeah.
Try to keep them happy and distracted. Right. Thank you so much, Lynn. I appreciate you bringing it in there. And I apologize for being salty. It just seems like such, not easy. It sucks to watch baby get their shot, but such a simple thing to do to protect the babies that we cherish in our lives.
And we open up so many opportunities.
In our community.
So many opportunities.
Yeah.
For safe living.
And we've had them for so long now that we know that they're safe.
Yeah.
We know that they're safe. Right. And I just get so upset that people get lied to and then preyed upon so that they can make money on their shows or sell their magazines or their vitamins, and our children's and our community and our families suffer. It angers me. Yeah. Thank you so much for bringing that back up so we could discuss it. So what are you going to talk about next week?
I think lymphadenopathy, or as we call it in Del Norte County, lymph nodes.
Okay. So those little things in your neck?
Oh, they're all over.
All right. Yeah. Well, I've got a lot to learn. Yeah. Thank you so much, Lynn. This is Health Matters on KFUG Radio. If you'd like to listen to this episode again, you can go to the YouTube channel and go to the playlist for KFUG Community Radio and listen to this or any of the other episodes that you've done for the past 7 years. Thanks, Lynn. I'll see you next week.
Thanks.